Please talk about Geisinger's medical home model as it relates to the success of your telemonitoring program and better overall patient outcomes.
Sure. I know that Geisinger has been working for many years now. Since 2006 was when the first medical home clinic site was activated or was rolled out. And so our medical home model here at Geisinger predates the telemonitoring per se. But those case managers who are extremely hardworking, extremely overworked, sometimes dedicated people, are always looking for extra tools and ways to help them manage the patients that they need to and extend their reach. So as I said, the study was really built on looking at all patients that had case managers, and most of them would be people in the patient-centered medical home model, but then trying to see what the additional effect of this monitoring is. So Geisinger has published a couple papers looking at the medical home model itself, because it's something that they've been working on for a long time here and continuing to grow from originally we had in 2 clinics to now almost all of the primary care sites. And we continue to work on asking questions around that, the medical home model itself, and how does it work, what makes it work, and things like that. And then on top of that, I think both Geisinger Clinic and Health Plan are always looking for additional components or additional aspects that could be added into the medical home model to help the case managers do what they need to do. So it's all parts of a whole, and sometimes the difficulty, I think, in all of these kind of initiatives is trying to figure out and isolate which parts are having the most effect and which parts are needed and which parts maybe aren't as needed, and that's really hard to do most of the time. In this particular case, I think we had a good opportunity to isolate this one particular approach, this telemonitoring approach, and look at it with and without and see what the impact was of that. I think the message here is that we always want to be trying to do the best scientific studies we can of these quality improvement initiatives and health services that we're providing to our patients to find out not only are they worth whatever's being spent on them, but are they really improving the patients' lives and keeping them out of the hospital and keeping them out of the emergency room. I think most people would argue those are good ways to improve their lives. So there's still a lot of really complicated questions out there in terms of isolating different effects and really seeing what has the best impact. But hopefully this study can contribute to that literature and to other people that are trying to ask the same questions as we are.